I'll be talking about the strategies to achieve the objectives of this policy. Strategies to reduce the stray dog population are human capture, sterilization, vaccination, and microchipping of the stray dogs, and increasing the adoption of stray dogs through incentives and simplification of the registration processes, and prevention of abandonment of the pet dogs through strict legislations. Then putting high taxation for adoption of foreign breeds and penalties for not having license for pet dogs. Then shifting the rabid, unhealthy, free roaming stray dogs to the shelters, and providing subsidies for creating shelters at the private areas, and offering free vaccination, sterilization, and microchipping for the pet dogs along with the OC pills for female dogs during their fertile period by tracking their estrus cycle. The strategies to reduce the number of dog bite cases are shifting rapid, aggressive stray dogs from the public places to the shelters, then legal actions against owners of pet dogs biting the public and compensation to the victims, and conducting the IEC and BCC activities to understand the dog behavior and safe feeding practices to reduce the human dog conflict, then creating the app based tracking for the stray dogs by municipality team at the ward level to track the census of the stray dogs at each ward. Then creating a redressal mechanism with helpline numbers for the dog bites and other dog related conflicts. Then keeping a trained dog handlers at the vicinity of the ward to handle the emergencies related to the stray dogs. Then banning the aggressive dog species to prevent the dog bites, and prevention of crossbreeding of the stray dogs with other canine species also in the strategies. The strategies to ensure the responsible pet ownership are mandating the wearing of muzzles and ropes for the pet dogs outside their home. And to reduce the human to human conflicts related to dogs, there should be strict redressal mechanism and strict laws for the same. And free ABC services should be provided for the pet dogs as well as for the adopted stray dogs. Then prevention of abandonment of the pet dogs through strict legislation and high taxation for the adoption of foreign breeds and penalties for not having license for the pet dogs. The strategies to ensure the establishment of community engagement can be creating community dog care committee for welfare of the dogs as well as the residents of the community. And this community should ensure and support the protection of disabled, beggars, and other marginalized people from the dog bite. And they should support the other agencies which are acting for the protection of the livestock and wildlife endangered species from the dog bites. And this committee should get donation and funding from others for the creation of the shelters for the stray dogs. And also it should encourage a proper waste management by each household at the ward level, and it should identify the community preferences about the presence of stray dogs at their street through conducting gram sabha meetings and acting accordingly. To achieve the target of elimination of rabies by 2030, the strategies include free treatment and vaccination of dog bite victims at all hospitals and provision for reimbursement and reinsurance by government if treatment is taken at private hospitals. Vaccination of all dogs in the country by next 2 years, and periodic re-vaccination with booster doses every year for dogs. Prevention of rabies to wild vertebrate animals through stray dogs, and collection and reporting of dog bite and cases of rabies for monitoring and evaluation, and strengthening the disease surveillance system for the same, and increasing the infrastructure, capacity building, and human resources for treatment of dog bite and ABC activities. Then conducting the pilot studies at the hot spots of the dog menace in a town with 50,000 population at each state by sheltering all stray dogs for 6 months after obtaining public opinion and publishing the results.